Right, in terms of some of the what we consider to be sort of key partnership and areas of innovation, in terms of sort of brevity, we've actually sort of listed on the next two slides issues that we think actually are innovative and do actually sort of demonstrate partnership working. But if you look at all of those issues, what it actually sort of demonstrates, especially around the smoking cessation work stream, is that we've tried to actually sort of develop a multi-channeled initiative and program, so that we are targeting various areas and we're actually sort of giving people enough opportunity to actually sort of avail themselves of the smoking cessation services if they want to. And so linked with that is, as I said, the communication and marketing side of the program, where we're actually sort of informing people as well about what the opportunities are there. So there is a very wide range of different sort of types of opportunity. Just to highlight some of them, the direct targeted action, we've actually sort of gone to faith settings, the East London Mosque, other church groups, local synagogues, and we're working there with community leaders so that at that level we're actually sort of promoting the service through those sort of particular areas. And again, at the other end of the scale, in terms of general sort of targeted areas, we've been doing a program of street-based communication and contact, whereby where there's areas of sort of high footfall, we're actually sort of speaking to workers and residents within the borough and actually sort of encouraging at that level to actually sort of get some interest in the smoking cessation, and if they are smokers, obviously sort of use the services that are there. Again, it's another slide that highlights some of the areas that we've actually sort of been involved in. Picking out some of those, Bob the Builder, the construction workers, it's a new initiative that's started to take place. Hamlets, I don't know if you know, is one of the Olympic host boroughs. A lot of construction going on at the moment. And the smoking cessation service have actually sort of gone and contacted those construction sites, because construction workers, again, they're known as having a high sort of prevalence of smoking, and so there's an ongoing program there of engaging with construction sites so that we're actually sort of engaging with workers and trying to actually sort of target smokers to actually sort of give up. And again, there's a number of other initiatives that are actually is detailed there. In terms of the case studies that we presented to the award, there are two there that we've got. I'll speak to the first one and then I'll hand over to Jill, who will speak to research and evaluation and continue the rest of the presentation. But the Smoke Free Business Award is something that my service is actually responsible for. It is something that we think is an innovative, and we think it's the only one that exists in the country. And where that development came from was that my officers go into business premises, they're actually checking up on compliance with smoke-free legislation, and what we sort of decided was that, well, whilst they're there in businesses, why can't we engage those businesses with getting them on board to actually help and support their workers, actually, if they are smokers, to give up. And so what we've done is promote an award whereby those businesses, they can actually satisfy the criteria, and if they're satisfying the criteria, they're complying with the law, they've got good policies in terms of how smoking is regulated on their premises, and they're actually sort of demonstrating a will to help their workers actually sort of give up smoking. And to date, over the first year, we've actually got 75 local businesses that have actually achieved that award. And what we've also sort of assessed is that in terms of the businesses we've gone into, that's 10,000 staff within the borough, 10,000 workers within the borough that we've actually effectively sort of come into contact through their businesses. And what that means is that we've actually sort of reached about 800 sort of smokers from that initiative so far. And obviously we hope that initiative will continue. That's all I've got to say, so I'm going to hand over to Jill now so she can actually complete the presentation.
Thank you. The other case study that we presented was the research and evaluation work stream, which is our fifth work stream and the newest one. And what we've done is we've brought our academic partners and healthcare providers and the local authority together. And what we're trying to do is develop a sort of research and evidence base for the programme that we're doing, but also add to the evidence base around smoking cessation and tobacco control. And we are seen as leaders for this in London. In terms of what the partnership and innovation have achieved, if we look at our stop smoking target, the local area indicator, we've exceeded the target over the last year, and we're on trajectory to exceed it even further this year. You'll see that from the breakdown of where the quits have come from, that actually what we're trying to do is also meet the needs of our community. At the moment, we measure a successful quit at 4 weeks, which is the standard DH requirement, but what we've started doing now is actually looking at it at 6 months and 1 year, because obviously we're interested in long-term follow-up and see how successful people are. So where are we up to, and what is the future? The strategy's been implemented for about 1.5 years now, so we're in the process at the moment of refreshing the strategy, and we've got a meeting next week with our key stakeholders to do that. And part of that will be reflecting on progress to date and also what we should be doing in the next 18 months, because obviously things change. For example, we've had an increase in shisha use in the borough. But we're also conducting a robust evaluation of our strategy to give us direction of how we should take things forward, and that will be done externally. And what we're really looking to do is to make it as robust as possible. For 2010, we've got some ambitious programs, and the one I'd like to pull out is the smoke-free homes. What we've started doing is working with our local fire brigade, and as many of you will know, this has been done in other parts of the country, but I think what we've got in Tower Hamlets is a particularly high rate of domestic fires, 50%, which are due to smoking or smoking-related paraphernalia. So we're training the fire safety officers at the moment to give smoking cessation advice to people who are deemed at high risk of fires, but also fire safety advice about, say, for example, furniture. So we've got a sort of key partners working together on this particular piece of work. Has the partnership added value? Well, smokers cost the NHS an awful lot of money, and certainly we have early indication that there are savings to the health economy because of this piece of work, both in direct costs of hospital admissions and medication, but also in indirect costs as well. The partnership has sort of ambition as well for taking things forward and using resources better in the future. Certainly a lot of the joined up working has driven more smokers into the service. You'll see from the slide that we've been working a lot with optometrists and dentists. The other group that we've been working a lot with is the registered social landlords as well, who have housing officers who will go and visit people in their homes and can easily identify the smokers. So we're really looking as widely as possible at getting the message about the importance of not smoking from a health point of view, but also from a safety point of view across as well. And we're also very keen on reducing second-hand smoke and unnecessary exposure to cigarette smoking as well. In terms of what we've learnt, I think it's fair to say it's been a great journey so far, and I think we've all enjoyed what we've achieved in working together. What we've also learnt is what works and what doesn't work, and what's really important has been to have high-level commitment from all organisations and genuine partnership involvement and commitment and wide stakeholder involvement in the true sense, and that has included a lot of local residents as well. We are a very diverse borough, and we've worked very hard to make sure that we've reached out to all sectors of the community. We're also fortunate in that we've had a dedicated workforce in terms of the smoking cessation team, but also the team based at the local authority who work on the trading standards and environmental health work as well. And I think that has been really key to what we've learnt. In terms of next step, we're already seen as leaders in London, certainly, of the work that we're doing, and we've presented widely, nationally and internationally, on the work that we've done. The evaluation is obviously going to add a lot of further information to us. The model that we've been developed has been mirrored elsewhere, both with tobacco control, but also in other public health issues such as obesity, weight management and alcohol. And there are a lot of lessons learnt from that.